Thank you, everybody. Apparently, Mr. Ruth is in Virginia on vacation.
Oh, I could just text me that too.
Okay. Look at him go.
Nice.
So we'll call the order a little late, and thank you, everybody, for your patience. Do we have any citizen comments?
No.
No. All right, we don't really have any discussion items, so we'll go to our active agenda with our coordinated transportation plan update. With Mike.
Michael. Yeah, thanks.
Kick it off.
Can you guys see my screen?
Yes.
Okay, you see
Well,
this?
no, we see you.
No, it's your face.
Oh.
Yes, you.
Let me try that again here. Share.
No.
Oh, that's not what I wanted to do. Ah, here we go. Sorry about that. You'd think this was the first time I've done a virtual meeting before.
We see it.
You can see it now. Great.
Yeah.
Okay, I'll just dive in. I want to first of all just thank Nikki and the chair of the commission for giving us the opportunity to be here today to provide an update on and really the point of this conversation is to receive input on the coordinated public transit human services transportation update, and I'm going to talk a little bit more about what exactly that is here in a minute. But this update is or the plan is being updated by the Palouse Regional Transportation Planning Organization. Becky's there in the room with you guys. In partnership with the Lewis-Clark Valley NPO. So I'll show some maps here in a second that kind of orient you to the study area, but this plan is meant to update, or this plan will be updated for both the Palouse RTPO region and the Lewis-Clark Valley NPO region. So let's talk about first, what is a CPT HSTP? Well, when you distill down all the acronyms, it's really about connecting people to services. And specifically, those people that we're talking about for the purposes of this plan are those folks that are reliant on public transportation. So those are low-income individuals, seniors, students, folks with disabilities. And these are folks that need to access services like doctor's appointments, get into the grocery store, get into a food bank if that's something that they need, or even just to get into work. I mean, this is all under the umbrella of human services. A lot of times that happens on fixed routes, and that'll just be, just the regular fixed route bus. But what this plan is really meant to do, and at its core, it's about coordinating all of the services and looking for ways to improve the entire universe of service. So that's really what a CPT HSTP is all about. Just real quick, just some nuts and bolts. We won't spend a ton of time here, but just to give you sort of a flyover of what this plan update entails. We kicked this project off several months ago, and we began by pulling together different data, whether that be socioeconomic data, of course, fixed route information, other human services, schedules, and services. There's two surveys that have been published, and I'm going to talk to you a little bit more about how you could get involved with those surveys. And then we're doing outreach, which is part of why I'm here today, is to connect with groups like this group to get input on the plan. Excuse me. There's an element of emergency management coordination that's going to happen. And then ultimately, we're going to get down to identifying what the needs and gaps are in that human services system and identifying strategies to help fill those gaps. So that will culminate with a draft plan that's scheduled to be delivered in June of next year. Ultimately, our schedule indicates that the final plan will be adopted in September of next year. So I talked about outreach. We've conducted quite a bit so far. We've reached over 130 unique individuals in our 4 days down in the community. Had a chance to speak to some of you. Thanks again for that, Mark, that conversation. But you can see on the screen here the other locations that we're at across both of those regions that I described to you earlier. So we've really just been trying to meet people where they are, whether that be at the grocery store, whether that be at a food bank. We've met with folks at libraries. We just hopped on the bus and rode around with people and talked to people that are relying on transit that way. So again, quite a bit of public outreach has been conducted already. But to give you a better visual sense, I talked about who's included in the plan earlier, but I kind of just wanted to show you what that looks like. So I mentioned earlier, but the four counties in Southeast Washington are under the purview of this plan. But importantly to your group, we've also included the city of Lewis and Clarkston, Pullman, and Moscow. So what you're seeing on these maps here are those concentrations of folks with disabilities according to ACS data. So where you see a darker color on the map, that represents a higher concentration of folks with disability. This is just one of the elements that we've looked at in our plan and as sort of a preview of some of the analysis that we've done to identify some of the populations that we're targeting. So really just purpose of this map was just to orient you to who's involved in the planning process. I mentioned a couple surveys that we've published. One of them is a provider survey. So if there's folks in the room that are affiliated with transportation providers, human services transportation providers, I'll finish the slides with some contact information and Nikki can distribute that to the group. But if you haven't received the provider survey yet and you're affiliated with a human services transportation provider, let me know and we'll get that survey over to you. And the other survey that we have is a user survey. And this is a survey that we've distributed on both the project website. Our transit partners have helped push this survey out amongst their ridership. And so far, we've gotten about 80 responses. So far, we've had good participation in this survey. You can see the QR code here on the screen, but if you want a direct link to this and you think there's folks that might be interested in taking this survey, I can get you that link and would certainly appreciate your help distributing that to those folks that are users of these human services or human service transportation services. So that's really the what I wanted to tee up in terms of the background of the project. The point of being here today is really just to have a discussion with this group about specifically about the disability population and some of the unique challenges that population faces. I've teed up some questions here that I kind of wanted to just open it up to the group for a discussion to get your feedback on. And I can walk through these, but really, again, the intent of meeting with your group here today was to, similarly to the outreach events we've done in other parts of the community, is to just get the unique perspective that your group can provide. I mentioned earlier that historically disadvantaged populations are key to this plan. And so this conversation is especially germane. And I've again got these discussion questions on the screen. I'll kind of just walk through them briefly, and then if it's okay, I can just open it up to some discussion and certainly appreciate any feedback that we can get here today. But just to kind of walk through the questions, first one is, what are some of those key transportation and coordination needs that you're aware of from the past 5 years? What do those needs and around transportation look like today? And really what we mean by that is we're trying to get a sense of how things have changed. Is there a particular need that you're aware of that has become increased? Is there a particular need that you're aware of that has improved over time? So we want to get a sense for that. We want to know what some of the biggest challenges that you folks are seeing when you're interacting with the disability community. What are some ways that this plan can address some of those needs? That's obviously a huge component of this plan, is how we can address the need that exists out there. One thing that we ran into quite a bit when we're talking to folks out in the community is a lot of folks aren't aware that these services exist. So things like Medicaid transport services, they might not even know that that's an option. And I'm just curious if you guys have observations about how well known or any opportunity that might exist to get the word out there better about some of the services that are available. And then the last question is, or the second to last question is related to coordination amongst providers. Do you have feedback on how we could potentially coordinate those services better? And then what barriers are you aware of and how should those be prioritized as we think about investing in ways to overcome those barriers? So with that, I'll leave these questions up on the screen, but I'm gonna pause there. And if it's okay, just sort of open it up to discussion and just get some reaction and feedback from this group.
Probably has plenty to say.
I spent an hour or more with him weeks ago, so I don't have anything new to add.
I can add something that might be helpful. So I work with adults with developmental disabilities and they live in a lot of different types of housing placements. And something that I've noticed that's changed, I think pre-COVID, there was more one-on-one staff within the residential assisted living facilities that were able to take more time to ensure that the residents were able to access the community for grocery shopping, for events, things like that. I've noticed that since COVID, the staffing shortages have really impacted that. And so when someone's living in a residential assisted living facility, they're very much reliant on somebody being able to help them access the community outside of the staff that are operating in that living environment. And that has been a challenge. And so transportation does come into play with that because there's not, it's been challenging for me to find ways for them to get out into the community for things like grocery shopping and stuff like that. I can link them to transportation that gets them to a doctor's appointment, you know, pretty much all day long, but finding transportation that can get them out into the community to go do some of those like leisurely activities or grocery shopping has been a challenge.
Could I? Sorry, I didn't mean to interrupt. If there was another thought, I just was going to ask a follow-up question to that, but somebody in the room.
No, go
maybe
ahead.
Okay. I just wanted to kind of drill down to that a little bit, and I'm curious. You mentioned that one-on-one interaction. Do you think that interaction previously, when there was more staffing and there was more opportunity for that to occur, was that one-on-one interaction? Was that linking that person to a fixed route service? Was that helping them navigate dial-a-ride, or are you saying that those services aren't as available from a proximity standpoint, or are you saying they're not there to provide that skill to help that person navigate the system?
Yeah, they weren't really helping the people navigate the system. They were kind of providing that service on their own from within their agency.
I see. Okay.
So now that that's no longer available, then it creates a situation where we have to find other resources that can provide them with those opportunities outside of the facility. Like one of the living places, they used to have their own van. And they would just kind of load up whoever wanted to go, and they would go out into the community and they would go shopping, and they just don't do that anymore.
Right.
So now some of those people that do want to get out into the community, finding ways for them to be able to do that has been difficult.
Thanks. Yeah.
I'd like to follow up with some questions. So first of all, you're talking just Lewis.
Yes, my clientele, yes.
Because I'm familiar with a similar situation in Moscow.
Oh.
Secondly, yeah, what do you mean by your clientele?
The adults that I serve with disabilities, they all live in Lewiston.
My apologies for not knowing what agency.
That
you work for?
Oh, I work for New Horizons. Yeah.
Okay. And you don't provide transportation?
No, and I used to be able to, but that's something that was taken away from us as service coordinators. I used to be able to, I didn't get reimbursed for it, but I was allowed to do it, and then that got taken away and we're no longer allowed to do that.
Well, in that case, I would just want to echo the same thing. Because I've seen it, where agencies handled their own transportation for their own clients, and suddenly that's starting to vanish. And the agencies are like, well, you're on your own, or you need to find those resources through the community. And those resources through the community are not robust in this area, in this part of the world.
Yeah.
And up in Moscow, I'm aware of 3 young women with disabilities living together in a 3-bedroom condo, and they get picked up every day by somebody. And I was just up there this morning, and I saw that it has nothing to do with Interlink. I was up there this morning and I saw the pickup, and there's no logo on the vehicle, so I'm not sure who's picking them up and where they're taking them to.
Right.
But I don't know, is DAC experiencing that?
We actually just have been dealing with transportation all week.
I bet you have.
Oh, I have been. So if we can find a provider, we potentially have the funding to fund somebody. As far as a reimbursement type
If you
thing
can find a
goes.
provider,
Because Coast and
Well, I heard some more bad news about Coast.
no, they're done.
Well, I want to
Sounds
get to
like-
that. I want to get to that.
Okay.
So I forget Mike. Okay, sorry, forgot your name.
That's okay.
You got to keep up because stuff moves quickly. Is Coast mentioned in your report? Because you may want to adjust that. Are they shutting down?
They're belly up. is what Mark said.
They're shutting down. We've had a couple of their drivers contact us to
Those are the
apply
words that were used.
to be drivers of Interlink, and I didn't talk to them. My staff did, and used those words. And I said, "Oh, surely not."
Oh, yes.
I said that can't possibly. They have the money. Maybe they just don't have the volunteers.
They don't have the volunteers.
So,
Because we were doing the reimbursement on all of that. And
Who's
you're
going to
paying
drive people
pretty
between
well.
cities? They're
I
the
know.
long distance. Who's going to take
That's
people
why
to
I've been working on it
Spokane?
all week. It's a nightmare.
They're shutting down.
Mhm.
You might
Yeah,
want
you guys
to.
I was going to say, you guys are breaking some news for me here. We've been trying to reach them to get them
Well,
looked into the
Monday,
plan.
Oh,
so my couch with the food RTQ and the NPO with my fit. Yeah, Coast is an agency within the RTQ, and I had not heard that.
yeah, my director just happened to be here. I work for Disability Action Center, and my director had been here early this week. And I went to talk to him about a transportation need for a specific client whose license is going to be taken away that lives in Orofino, and transportation options are very slim. And our conversation evolved and to Coast, because we fund Coast. And he said they quote unquote were belly up, and that would be no more.
That's good news.
Mike, yeah, when we spoke, I mentioned how Coast had withdrawn from, of course, this isn't part of your plan,
And
but
he
from
said-
Idaho, Clearwater, and Lewis County.
Right.
We're still serving the Lewis Clark Valley and points north, but
Mark said it boiled down to mismanagement.
of course, they weren't, yeah, Mark, your boss.
Yeah.
They weren't their own nonprofit. They were under Council on Aging, right? Of the police. And
Right.
so technically, Council on Aging.
No,
is-
I think they're intact.
Right, but I mean, Council on Aging is shutting them down as a program,
Yeah, I think so.
as a whole program. Wow. If I call, will anyone answer?
Well, I can tell you if you email, no one will answer.
Yeah. So just really quick, since this meeting is recorded and it'll go in the minutes, and just add that, Coast, the bus service, I assume that's what this is.
It's not about service.
It's not about service,
door
it's
to door.
transportation, door to door, accessible,
Transportation,
accessible.
door to door.
transportation.
So we're not officially saying they're closed down or anything like that. This is just conversation.
Yeah.
So I just add that. We're not, so.
Thank you.
We're not telling the world for that.
Right.
Yeah, if
We're
you
not
want
really
updates on
yeah.
Coast and that
Okay.
business, please reach out to them.
Yeah, and just kind of moving on from that topic, I wanted to follow up with a thought that I heard about those providers limiting transportation services internally. I think one of the thoughts that was thrown out there earlier was part of the limitation is these I assume like in-home healthcare providers are limiting the amount of transportation services that they can provide internally. Do you have a sense for why that is? Why is it? Is it a lack of money? Is it folks unable or unwilling to do it anymore? Do you know why that is?
From last, yeah, if you have a better answer.
I'm sure Wilson Transit, the answer we have gotten, because we have seen a massive increase in rider requests from those facilities, I mean, both small and big, is drivers, equipment costs, everything else, because our,
The fire department's even seen an influx.
Right.
Richie Lucas just gave a presentation yesterday at our stakeholder meeting about community service workers, but doctor's appointments, grocery shopping, picking up meds, those are calls that our
had-
fire department's getting.
Well, and I had a gal whose living facility, they have some kind of access to a van. I don't know, I don't understand it all completely, but they took her to a counseling appointment and then sent me an email saying that they wanted me to take over the coordination of her counseling services going forward because they had to take a staff off the floor to drive the van to take her to the appointment. And she was wrong about the appointment time and they were there for 3 hours. And so I think there's also that staffing component of, it sounds like somebody who would typically be providing direct services on the floor was removed from that setting. And so I think staffing is also a big component of that as well.
I see. Okay. That's helpful.
Nice. So I just have a clarification question, Mike.
Sure.
On the agenda item, the coordinated transportation plan update, is Kittleson and Associates, is the work you're doing for the city as far as our transportation services are concerned, or what's the scope here? I
Yeah, so
suppose.
yeah, great question. So the Human Services Transportation Plan is an eligibility. It's a lot of things. One of the things that it is an eligibility document for providers to receive federal funds. And so this, among other things, is going to provide those providers that we talked about earlier in on those maps that I showed you. So all of the providers that operate within the bounds of those maps, most of them receive Federal Transit Administration funds. And in order to receive those funds, they've got to have this plan in place. The RTPO, Becky's group, and the NPO maintain this plan over time, and it's updated on cycles. And so it's just time for this plan to be updated based on that cycle, and this plan will serve as that eligibility document. But really, beyond that, it's meant to guide those strategies that that all of the human services providers pursue to increase opportunity to connect folks with services. So hopefully that answered your question in terms of whose plan it is.
Yeah, that does. So how does this plan support or supplement like the Dial a Ride program, for example, that the city of Lewiston has?
Becky, did you want to jump in?
Like we're talking about going and picking people up.
Yeah, so I can add to that.
It's a plan. That's all it is. It's a plan.
So it's primarily, so it's updated every 4 years, primarily driven by WashDOT, Washington State Department of Transportation. ITD likes to see it done too, but the 4-year deadline is more strict in Washington. Washington agencies must be included in it to get their funding through the Consolidated Grant Program for Transit. The MPO gets involved though. One of the benefits I've heard, so I'm newer to the MPO, I've only been there about a year. One of the benefits I continue to hear from Shannon Grove, who used to be the director, is including the MPO in this and the Idaho agency, so specifically Lewiston, is it makes them eligible to apply for 5310 federal funding. And so one example that came out of this plan update in the past was some of the public input we received was about sidewalks not being sufficient to get to transit stops. So people weren't using the bus because they didn't have a safe route or ADA accessible route. And so City of Lewiston was able to apply for 5310 funds to do that sidewalk because that was included in this plan.
Gotcha.
So it's not specific to Lewiston Transit's funding necessarily for their operations. That comes kind of a different flavor. Yeah, but that's kind of the benefit for Lewiston in this plan. The bulk of the requirement is that we're doing continuous public engagement, continually asking the public how are existing services meeting your needs, where are we failing to meet your needs, and then working to constantly do better. So that's kind of
And we do have a public engagement requirement, which this does help fulfill.
Perfect. Okay, now. Yeah. Sorry to throw things off.
That's a good question.
I have something that I remember we've talked about this a couple times, transportation in this commission. And one of the things that was discussed in length was after hours, like weekends.
Yeah.
People who maybe leave the hospital for treatment and there's no longer a service to provide them a way home. And then any kind of like community events that might be on the weekends or after hours that we would want members of the community who have disabilities to participate in these programs. There isn't access for that. And so kind of the clock ends at a certain point and there's still things going on or needs that are happening, but there's nobody to facilitate that transportation.
I've had to go seek that out many times when we've had like dances and stuff for DAC.
Mm-hmm.
And go seek outside agencies that could maybe bring people down from rural areas, like in a group with a van or bus. And they're few and far between if you can find somebody.
Yeah, because I remember the hospitals was a specific sticking point. I don't know, Mark, if you remember about, well,
I'm the one who brought it up.
yeah, like who should be providing this service because there's a need and it can't be our ambulance. It has to be.
Well, it will be.
Yeah, but to Mark's point, it will be if there isn't some sort of transportation provided.
Everyone recognizes the problem. Nobody wants to pay for it. And everyone wants it provided free to the client. That's not a viable formula.
So that presentation Richie Lucas gave, to us at the stakeholder meeting. Have you guys heard him or Bobby Marsh talk about the community service worker?
I haven't
model?
heard.
I think that might be a good idea for at least individually to inquire about, or I can send you the slides and stuff. It was really good, and I talked a lot about transportation, and he
Is
gave a
that
lot of
something that,
numbers.
like, Gilson should maybe
Yeah,
reach out to?
yeah.
Richie?
Richie Lucas, yeah, at the City of Lewiston Fire Department. Because the numbers on there just for transportation, when he started naming off that he's taking people to pick up meds and to doctor's appointments, and this is our fire department, and we're limited because he covers 1,600 square miles because it goes all the way up to
Wow.
Grand Rapids.
Wow.
And I didn't even know that.
Yeah, and you're basically taking.
You're taking that away from
Like
if we
a
have,
service for something else that might be
Mhm.
emergent.
What pays for it?
tax dollars, I think. Whoever pays the fire department salary. But he did a cost benefit analysis. If we did the community service worker, so like in Clarkston, their model, he's housed under the fire department, but he's funded by Greater Health now. So his
Oh,
salary is
that's,
paid.
that's just grant funding. That could disappear at any time.
Well, right.
Yeah,
And so
on the Washington side of the river, not Idaho.
yeah, he just was proposing a similar model here. But he's got to find the funding for that worker and then the vehicle that worker would drive. But the point I was getting at is the fire department's already acting as that transportation because it's not available to older folks and disabled people in the community. They're doing that now.
Wow.
The numbers up there about how many that there's from 2020 or 2023 to the present each year and each month, how many people and how many calls they're getting. And I mean, some of the months it was over 100.
Yeah, Mike, if you want, Deputy Chief Lucas's information, I can provide that to you.
Yeah, please pass that along, especially if there's numbers related to the amount of trips that they're providing. That'd be helpful.
I have a
Just
question. For those of you who work with, like you were mentioning, the agencies that used to have services to help people. Do you see that changing at all? Do you ever see that kind of coming back? Or do you think that
I was really hoping so, but it seems like it's not. And then one thing, it's pretty specific to, because one of the ways that I was thinking outside of the box to help these people access the community is I linked them to peer support specialist services, and that's gone to, that just got cut. So that's no longer available. And so it just seems like those different barriers are increasing and making it harder.
I will say, I'm gonna plug myself in right here. One of the things that I was hired under a grant, so that's fun, through LCSC's workforce training, that we're developing a direct support professional apprenticeship program, which while it won't necessarily address some of the advanced age population, the idea is that long-term, it will help increase the severe staffing shortage that is affecting DDA and ResHab agencies, and eventually self-direct and things of that nature. So that is not to say that it won't change. We'll see if it works. If it doesn't, I'm out of a job. So I have a vested interest besides just the altruistic one. So not that it won't change. It won't be anything that won't change.
The one thing I'd add to that is what we've noticed with the increased paratransit customers from these facilities that formerly had their own accessible transportations, they're divesting from their equipment as well. So that's
Oh, wow.
gonna be
Yeah.
further barrier.
Yes.
Have you, Mike or Rebecca, spoken with Asotin County Community Services? That's an office.
I have not.
no.
Not on our list.
So they're in the same building Interlink is in. They might be able to shed some light. So they're not a nonprofit. They're a department of Asotin County government. I guess in Washington, every county has such a department to help people with disabilities find jobs. So aside from what you mentioned about hospitals, they were a big one beating the drum on some of our people none of whom drive for the most part, their job goes well beyond the bus service time, and they need a way home at 8 o'clock, 9 o'clock at night. And who can provide that service? And hit and miss, their own staff, leaves the dinner table and goes and drives people home. Now, Rebecca, you might be aware of this. They got a grant. Washington State has this money. Is it called Dan Thompson money? Okay, if you don't know what this is, Mike, you better look into this. So there's this big slush fund that Dan Thompson he's dead now, and he was a director of the Washington Department of Transportation years ago, and he left his estate to create this fund for transportation programs. Only counties can apply for it. Counties themselves apply. And as much as Interlink would love to be able to apply to get our hands on this money for the benefit of Asotin County, they turn it all over to Asotin County Community Services, which is one of their own departments, to apply for the money. And you're talking 6 figures. Okay.
Can they split it?
What?
Can't they split it up?
They don't want to. But anyway, so well over $100,000. Actually, and I think it's a 3-year grant cycle. Well, then she went out on the previous grant cycle and hired Coast and gave them the money to transport her people. And the first thing Coast did was take 70,000 or a bunch of it to buy a van, brand new van, but then didn't do a good enough job because they didn't always have drivers available. So then she took the money back, or took the program back. And this was all like 2 years ago, 3 years ago. But I know she re-upped on the grant. I know she re-upped, and Idaho counties don't have access to this. So you're familiar with this.
Yeah, I know, I've heard the same story.
The name is Dan Thompson.
I don't know about the funding, I've just
Okay.
local ramifications, yeah, I've heard. folks say
I
so.
mean, and consequently, Whitman County and Garfield County and Columbia County would all have access, to this money if it could just be coordinated and used more strategically. It's private money, but because it was this guy's estate, but administered through the Washington Department of Transportation, and you definitely should
Yes.
get more informed about it. Wouldn't help Idaho in any way, but I think it could be more strategically used. And I covet it, but we can't access it either.
Yeah, we'll look into that, Mark. Thanks for pointing that out. Real quick time check. I know you guys have more business today, so I don't want to take too much more of your time if there's other stuff to get to. Happy to take more feedback if there is, but I just wanted to be mindful of the rest of your agenda.
Their survey. Yeah. You mentioned there was information for surveys.
Yep. Yeah. So what I'll do is, Nikki, if it's okay, I can just forward you the links for both the user survey and the provider survey, as well as a link to our virtual open house, which contains some more background information and some more information on the plan update itself, and also includes those 2 links. So I'll get that over to Nikki, and then hopefully she can just push that out to the full group.
Yeah, I can do that, definitely.
Great. Thanks.
Does anybody have any final comments or feedback for him?
Thank you for the information.
Yeah.
Yeah.
Very
Thanks so
much.
much for the time and the opportunity to present and take your feedback.
Great. Well, you don't have to stay for the rest of the meeting if you don't want to.
Yeah. I'll leave you guys to it. Thanks so much.
Thank you.
Thank you.
Okay. Bye.
Was there anything else that you two wanted to?
I don't think so, just really appreciate your input and spreading it as much as we can, and this was good information received today, so.
Are you now the director of the Lewiston Clarkson MPO?
Yes,
Change jobs, or it's a part-time job?
I do the RTPO and the NPO together, so together they're a full-time job. Yeah. Yeah. Kind of, halfway took over last October, but Shannon and I were kind of tag teaming, and then this October it became this week, so, yeah, so it's. Yes, it's in the car.
Mine is too.
But I can get you,
Okay.
I'll write it on his paper.
Okay.
Or if I could get contact information for the group too, then.
Yeah, I can email that to you if you want.
Awesome. Thank you.
Yeah, I'll connect with you.
Yeah.
Thanks so much. I'll take to the second item.
All right, so next up then is our letter of support for grant funding. Dan Johnson, Justin, sorry,
Yep.
reached out seeking a letter of support, a unique letter of support.
A unique letter of support, which I drafted with me and ChatGPT. And take full
We
ownership.
contributed a slight,
Yeah, Constance has seen the letter, but basically it's just kind of summarizing what Dustin's letter had requested, that you're supporting, any kind of grants related to that specific project that they have. I just, I made it an item in case you guys wanted to take a vote in agreement or.
Which side of the street, or is it both on Borough?
She really knows both.
They're on the south side, but without the sidewalks, not the side of the fair.
Yeah, because they should pay for their own sidewalk.
My kid's dad lives on 15th and Burl, and it's not paved all the way down in front of their house even, because I don't want them to walk home.
The north side has a sidewalk, you just gotta have curb gutter. So it's gravel sidewalk, gravel road.
Mhm.
More of that.
And that's a fast road.
Mm-hmm.
People
Are
go
the
fast on the road.
homeowners along that stretch, what, they had sidewalk waivers? Or what am I missing here? Aren't the landowners
Just haven't made
usually,
improvements to require it.
Hmm?
They probably just haven't made improvements to require it.
aren't landowners usually taxed to put in sidewalk and curb improvements?
Or remodels, right? Yeah.
Is there value?
Well, I would look into that.
Well, isn't that what the in lieu of money goes towards, is your ability to take that money and put it at greater needs throughout the city? Or
Yeah,
project
when
that they
there
have?
isn't a property that can be charged or where the expense is greater than that. I mean, the city got into huge amounts of trouble when they used to waive it. Waive it, you will never be charged. And so after that, they simply postponed it. They handed out postponements. Someday we are going, I was on planning and zoning commission for 9 years. I saw this happen. Someday we will come after you for sidewalk improvements, just not today. And so it's always important to determine if there was a waiver or a postponement or when. But if those houses stay back before annexation, then yeah, it might be impossible.
Yeah, I don't really know much about it, but yeah, I always thought it had to be like a certain value of improvement
Mm-hmm.
in
Well,
order
that's
to
a-
require it.
I can look into that.
Well, that's a remodeling. But
And I'll just note that we wrote our own letter of support already. This is included in it, but we do have several mobility device using clients on the side of the street that does not have sidewalk. That areas.
gosh, that's interesting.
I guess the motion on the table is to approve to send on a letter of support. I will,
Make a motion?
yeah, make a motion to approve,
Somebody
I
second it?
need to approve
I second
you
it.
signing a letter.
us approving, yes.
And I have the letter if anybody would want to read it, and I can certainly send it to you too.
Interest. Yes.
And like I said, Constance has already vetted it.
Yes. Give my kudos. We have a second?
Yeah.
Oh, Johnny seconded,
Yeah.
so all in favor?
Aye.
Aye. And any more discussion for nays? Motion passes. That'll be signed. Next active agenda, approval of meeting minutes from October 9th. Mark, are there any?
Are there any corrections?
No,
corrections
I
that need
didn't
addressed?
make corrections, but
You know, it always makes Leah feel good when you don't have any correction.
I
I feel like she did a good job.
But I will, might not be, I can wait till under, Commissioner comments if I remember. No corrections. I move adoption as amended.
There's a second.
I'll second that.
All right, all approved?
And
And that is that, who was the second?
Jessica.
Oh, thank you.
Any disapproval? Passes. For future agenda items, we will have Dr. Doug Cruisers from Workforce Training. They have quite a few programs that help address some of the needs faced by individuals with disabilities, and the elder community, that he can come and discuss some of the programs.
Does the college provide transportation?
Nope.
Right. I mean, just as an example, because everyone in this area loves to talk about problems and nobody likes to solve them. When they were getting ready to open is it the Schweitzer Technical Center? Okay. It was this huge deal. It was this gigantic emergency that the college needs to have some kind of shuttle between the downtown campus and the Orchards campus. Oh my God, there's students without cars and the bus service doesn't run directly there. And we need to do, and they talked to a lot of groups about this. And then suddenly it just all went poof. Not a problem. It's a student's problem, right? No shuttles, right? I mean, yeah, and I hope it's working out. I guess most students
Right.
have cars, but I mean, for a few months, it was like the big talk. We've got to have a shuttle. We've got to connect these two campuses. And then everyone decides, not a problem. It's the
So there's
students.
your additional feedback.
It's the students.
this
It's the
city.
students' problem.
Mhm.
And, I assume they probably talked to Suzanne about it and she said, not our problem. And, it just, I mean, transportations is an issue and nobody wants to fund it. You weren't there. It's not
I
your problem.
wasn't, and
It's
so
not
I
your
actually,
problem.
that was not
But I'm just
something that
giving-
occurred to me, and that's actually part of the current technical education portion.
Just giving an example.
Yes.
I wanted to ask about a future agenda item. So obviously we had to cancel last month's meeting because the manager was very nice.
I've actually ran into him.
Yeah.
And we talked.
Okay,
And he apologized profusely
Yeah.
to us and said it was not him.
No.
It was corporate.
yeah. He was very nice and he was very communicative. He just wasn't given the permission to be able to come and present. But I did get the name and the contact information
Mhm.
for one of the corporate individuals. I had been emailing, trying to get his information. He did leave me a voice message. If that's something that you want me to try and pursue, is to see if somebody would be willing to come and talk about that
I think that
facility.
would be very beneficial.
Okay.
I have not heard firsthand, but I've heard secondhand that there are still some concerns
Oh,
regarding,
Okay,
They stayed primarily empty because of it. They have 9 empty beds right now and they've been empty for some time.
But because they have Medicare, they don't qualify.
They do too?
Yeah, so I called, maybe it wasn't that one, I'll talk to you. about it.
Okay.
yeah, okay, so that you guys are still interested in having me kind of try and pursue, I can't, they have their own rules, so I don't know if they're really
I
would be
think-
willing to, but I'll try to.
It's not a strong priority of mine, but I think Matthew's speaking about Matthew. I think he won.
Okay,
Yeah, he does.
Yeah.
Okay.
I would be.
and I think
Pretty strongly.
as a I think the community
I would be.
would benefit from that also.
Moonlight Mountain.
Moonlight Mountain, yeah.
But are they
Yeah,
out
'cause
of
I
town?
called them.
I mean, they could do it by Zoom.
Yeah,
They're
this
Boise, yeah.
person is, I don't know if he's a local person, and the manager was fairly new, and so he wasn't given the permission to speak on their behalf kind of situation. That was my understanding of it.
No, that's exactly what it is.
Yeah, but, I tried to find somebody in corporate, and I think I do have somebody, and like I said, he left me a voice message, but.
He was comfortable in giving me a rundown,
Mhm,
but
yeah.
doing it on a public level, they called him and said nope.
Yeah.
That he had to lose jets, more or less.
So that's why I had to cancel it. I was trying to.
There are some, I mean, I could share with you guys what he told me. There are requirements for treatment when you're housed there. You have to attend 3 hours of treatment from 8 to 11 every day. And that's via Zoom, which I don't agree with necessarily, but, because if you're trying to have somebody get a job and do things, 8 to 11 is a really, really big kink in somebody's schedule if they're working an 8 to 5 or trying to. But they're required to attend 3 hours of treatment per day, and they have a case plan. But the housing itself is funded through the medical insurance, or through said funding. It's not billed to the person.
Okay. Well, then I'll try to pursue seeing if somebody who is the appropriate person would be willing, even by Zoom, like
Yeah.
we could have them attend. They don't have to be in person
Yeah.
to just talk about the program.
And then isn't the UGM getting somebody? to
January,
Open up their
Mhm.
services? I wonder if that would.
Jeremy would-
To know more about that.
he would come give a, what do you call it, a presentation.
I was going to bring that up.
Jeremy Stevens.
Union Gospel Mission. Because they're more visible in the community now. They're, and I don't even know who I mean by they. I haven't talked to them, but I've seen them around doing presentations. And aside from the fact of whatever you guys were talking about, the sober living and the fact that their facility will be able to house over 100 people, right? And some of them very well may have disabilities and
Right.
therefore be of interest to this group. But I'm also curious, I'm unfamiliar with their model. Well, I know that, but I mean, do they provide transportation? Do they
No,
have?
he states that if you go to the website and look on the website and the information, it states that they have to provide their own transportation.
Yeah,
I think that-
in Spokane, I've never seen a
Yeah.
Union Gospel Mission van going around everywhere. But so suddenly, once again, we are creating a facility of potentially over 100 people. And it's like, yeah, we don't drive you anywhere. And you're on your own. And okay, these people come to them as being homeless, right? I'm guessing they don't own a car unless they're living in their car. So, you know, this is foreseeable. This is absolutely foreseeable. But does the city bus run on St. Grove Avenue?
There is one right there.
But it only runs to a certain time.
Yeah, certain times.
This is gonna be a stupid question.
And one
probably.
direction.
But does the city have any room to expand on their hours if they had the funding?
That'd be a Chris-ish discussion.
Okay.
It's pretty strapped as it is.
I had asked.
Well, money is supposed to solve everything.
Well, that's what I thought too.
When you say it's
It's gonna
strapped,
take a
it's
lot.
strapping.
We only get a
Yeah.
certain amount of allocation for.
No, but if we found money potentially, would that
It
still
would
be the
have
same
to be
answer?
sustaining funds.
Okay.
One-offs just don't really work for public
Well,
transportation.
mhm.
services.
Yeah.
Because Chris, would it be, it's more than just wages. You've got benefits, you've got new equipment.
Right.
You'd have to have,
Fuel costs,
Fuel
equipment
costs.
replacement.
so it's like, if it were just a driver, it'd be one thing, but it's.
I'm not sure new equipment, you just would run the current routes longer. But
That's what I
but
was
gas
talking about,
costs,
But
yeah,
but
gas and
it
maintenance.
depreciates the longer you run.
Yeah,
And the more you run it too.
Correct.
so then you're having to buy newer than you anticipated.
Do you happen to know what the service hours are for the bus systems in Moscow and Pullman? Do they match?
They're a little bit later, I think.
Pullman's definitely. Take until 7 too. So, yeah. So Moscow.
And then Pullman's like 9, isn't it? Or 8?
I always get confused by what their
It's a little bit later than.
peak season hours versus.
Yeah.
Might pass along to Mike unless I do another survey or talk to him again. Because I guess private providers would
Mhm.
factor into a transportation plan, but why are there so few Uber drivers here in the valley? I mean, I just had this conversation 2 days ago with somebody. There are way more Uber drivers in Moscow and in Pullman for particular reason.
But there's none up there, so.
What?
Most people I hear from, there's not enough.
Oh, well, maybe that's a recent change, but boy, do they clean up when the bars close.
They have college students.
Right, right, but
That's the only time they.
to have 67,000 people in this valley and there's only like 2 or 3 Uber drivers and they only work like occasionally part-time.
Well, we didn't even have a cab service until recently. And I didn't know. Sometimes, some of the people that I work with, won't be able to afford it.
Affordability is an issue, but once
But,
you get
yeah.
the point, even if you can afford it, the
Yeah.
fact that it's not available just is so weird.
Well, wasn't there a time that MTM was contracting with Lyft, weren't they? There was,
Yeah,
Medicaid
we're getting more
transport.
topic.
yeah, we have, absolutely. It can always be, it can always be
Start
a
talking
future.
about things that we're not.
Future, a future agenda item, but
Yeah.
yes, I think having somebody from the Night Mountain would be great. Going back to,
Yeah,
what was?
she said, do you want to talk about elections? And Mark had mentioned before the meeting, do you guys want to add elections of chair and vice chair on January's meeting?
100%.
Okay. I got that done too.
Okay. Do we have any commissioner comments
Yes.
You
The,
remembered.
that we might,
I did remember, I bring this up most times. If the minutes for this meeting would record that there was no meeting in November, because otherwise those kind of things get lost, and you look at the October minutes, and it says next month, we're having this as a speaker, and then anybody in the future would be like, well, where are the November minutes?
I think that's a fair suggestion.
Meeting gets canceled, but there's no record of it. All right, thank you.
There is kind of a record of post those meetings.
Yeah, but the archivist 40 years from now may not be able to find that.
I would love to know what an archivist is doing 40 years from now.
Looking at
their
their
DAC meetings.
You never know.
You never know. Transportation could be the next, magic thing. Do we have any staff liaison?
No, I mean, I'll just mention that I am working on the 2025 ADA transition plan update. So I hope to get that in front of council sooner than we did last year, just to try to say a little bit more. It's not anybody, one person's fault. It's just there's so many people participating and contributing to the plan that hard to get it finalized, but that'll come before you guys here in the next couple months probably too.
Also, something big. We have on the city council, the kind of reassignment of boards and
Oh, yeah.
submissions, so it is quite possible you'll have a new city councilor here for next year. Just a heads up.
Are you going to suggest that you?
You don't wanna come anymore, or?
Well, if
They're doing it every year.
we
No, I know, but I
try
don't
and
look at it.
rotate just to get everybody a chance to participate in the different committees, so
Well, we have appreciated your input and
Yes.
thoughtfulness.
that was very enjoyable. I appreciate it all.
Madam Chair, for the record, did you want to talk about, was Heather's resignation?
Oh, yeah, so you all received an
So-
email today, yeah, that Heather Moore had
yeah.
resigned, got a new position and is not able to attend this meeting.
So
So that-
technically, she resigns to the city council, right? We don't have to take action on it.
No, but so that does create 2 vacancies, so if you do know people that might be interested in sitting on the commission, it'd be really great to get some new perspectives and contributions to this commission. And they can apply through the city clerk's office, the application's online. So,
At any time.
at any time.
101. Adjourned.
Yeah.
Feel about right?